So today we're going to talk about biceps tendinopathy. So basically what biceps tendinopathy is it's painful inflammation or degeneration of the long head of the bicep tendon. So patients who do a lot of repetitive supination, so kind of going from forearm down to palm up, or elbow flexion, or any overhead work, are more likely to experience biceps tendinopathy. So patients who are experiencing biceps tendinopathy will experience like a deep, dull ache over the front and top of their shoulder, and it might be particularly worse at night when you're laying on the affected shoulder. Activities like flexing your elbow or doing that supination that I was talking about can most of the time aggravate or provoke the pain. So a lot of times patients experiencing biceps tendinopathy will also have a lot of inflammation or swelling, as well as some dysfunction in the overall shoulder joint itself. So those things need to be addressed. So when a patient comes into the office with shoulder pain, we obviously have to assess the shoulder to make sure it's not rotator cuff, or there's not other scapular dyskinesis or anything else going on that can be causing the biceps tendinopathy to be occurring, because a lot of times it's not solely just biceps tendinopathy occurring. It's usually due to other dysfunction in the shoulder. So treatment in the office will obviously work on restoring that range of motion in the shoulder without pain, getting some of the inflammation down, and some things that we do would be working on some of the muscles, getting that biceps tendon to not be as tight, working on the shoulder girdle, just helping everything stabilize and work together to take pressure off that biceps tendon. So a lot of soft tissue work, scraping of that joint, cupping, needling of the area, and then as well as some manipulation of, the neck and the mid-back, because as we know, the shoulder girdle does work with and, attach to those areas of the neck and the mid-back. So it's really important that those areas are also moving. And then what we do is we give a lot of stretches and, strength training to kind of help stabilize that shoulder joint to, again, take pressure off that biceps tendon, so that everything can kind of work like it needs to, and just decrease some of that overuse and decrease some of that pain and inflammation in the area.